Hey there, it's Dr. Mike Thompson at the Upper Cervical Clinic of North Texas here in Fort Worth. And this is my expert tip of the day. You know, I'm often asked, how do I sleep? Or what side should I sleep on? Well, there's many variables to take into consideration to answer that question, but here's the overall big picture to answer that. First off, there's the structural component, or the way that your neck needs to be positioned in order to hold a specific correction. And then there is the physiological component, or the way your position can affect the systems of your body at night while you sleep. A Stony Brook University study suggests that how you sleep could actually reduce your chances of developing cognitive concerns later in life. The study was published in the Journal of Neuroscience, and it found that the way a person's body is positioned while they sleep could affect the brain's waste clearance system, or the way it filters toxins. It's also called the glymphatic system. While we sleep, toxins are flushed from the brain through tiny lymphatic vessels called glymphatics. And as the brain dumps around 3 pounds of toxins and chemicals and plaques out of the brain each year, this is actually the way that it eliminates it. So with that said, to answer the question structurally, the best answer, I think, is really to sleep on your left side. Firstly, it makes it easier for the heart to pump downhill, gives you better elimination, supports proper digestion, supports a healthy spleen function. It helps circulation back to the heart. It helps bile flow more freely. And if you get heartburn, laying on your left side should actually relieve it compared to laying on the right side. So there's many reasons to favor the left side. But now let's look at the actual structural or spinal part of answering that question. You know, you may already know that we provide very specific corrections to the upper neck, right near the base of the skull. So if the atlas or C1 vertebra has shifted, say for instance, to the right, then after the correction it makes sense to spend time at rest, either on your back, which is preferred, or on the left side, since you'll have gravity working with you to keep that vertebra position toward normal. Obviously, if your vertebra has moved out of the position to the left side, then we adjust it toward the middle, and then gravity will be working with you to remain keeping it in the midline if you stay on your right side. Now, for lower back pain, I always recommend either side, whichever is the most comfortable. Either put a pillow or a wedge between your knees. This will help take pressure off of your pelvis and stabilize it. And also, if you keep your knees bent, you'll also give relief to those muscles. So there's my expert tip of the day. If you enjoyed this video as much as I enjoyed making it for you, please share it with your friends. Thanks for watching.